Chronic wound infections are a silent pandemic threatening to become a global healthcare crisis. Unfortunately, management of chronic wounds is predominantly reliant on a limited number of options. These include low-tech manual debridement and low-cost dressing protection, or alternatively high-tech and high-cost antimicrobial dressings and medicinal products. All tackle only a single element of the problem. Severe infections require systemic antibiotics and amputation when all else fails. An international team has innovated a non-antibiotic treatment for chronic wounds using plasma-activated hydrogel dressings, showing potential to transform wound care and address antibiotic resistance. The treatment involves the plasma activation of hydrogel dressings that are commonly used in wound dressings with a unique mix of different chemical oxidants that are effective in decontaminating and aiding healing in chronic wounds. Researchers from the University of Sheffield and the University of South Australia believe the new method is a significant advance in tackling antibiotic resistance pathogens and has the potential to change the treatment of diabetic foot ulcers and internal wounds. More than 540 million people are living with diabetes worldwide, of which 30% would develop a foot ulcer during their lifetime. This is a neglected global pandemic which is set to increase further in the coming years due to a rise in obesity and lack of exercise. In England alone, between 60,000 and 75,000 people are being treated for diabetic foot ulcers per week. Infection is one of the major risks. Increasingly, many infections do not respond to normal antibiotic treatment due to resistant bacteria, which results in 7,000 amputations per year. There is an urgent need for innovation in wound management and treatment. The cost of managing chronic wounds, such as diabetic foot ulcers, already exceeds $17 billion annually. The benefits of cold plasma ionized gas have already been proven in clinical trials, showing it controls not only infection but also stimulates healing. This is due to the potent chemical cocktail of oxidants, namely reactive oxygen and nitrogen species RONs, it produces when it mixes and activates the oxygen and nitrogen molecules in the ambient air. Scientists said that antibiotics and silver dressings are commonly used to treat chronic wounds, but both have drawbacks. Growing resistance to antibiotics is a global challenge, and there are also major concerns over silver-induced toxicity. In Europe, silver dressings are being phased out for this reason. The international team of scientists has shown that plasma-activating hydrogel dressings with RONs make the gel far more powerful, killing common bacteria. Although diabetic foot ulcers were the focus of this study, the technology could be applied to all chronic wounds and internal infections. Despite recent encouraging results in the use of plasma-activated hydrogel therapy POT, scientists face the challenge of loading hydrogels with sufficient concentrations of RONs required for clinical use. Researchers have overcome this hurdle by employing a new electrochemical method that enhances the hydrogel activation, as well as killing common bacteria that cause wounds to become infected. The researchers say that the plasma-activated hydrogels might also help trigger the body's immune system, which can help fight infections. Chronic wound infections are a silent pandemic threatening to become a global healthcare crisis. It is imperative that scientists find alternative treatments to antibiotics and silver dressings, because when these treatments don't work, amputations often occur. A major advantage of POT technology is that it can be used for treating all wounds. It is an environmentally safe treatment that uses the natural components in air and water to make its active ingredients, which degrade to non-toxic and biocompatible components. The active ingredients could be delivered over a lengthy period, improving treatment with a better chance of penetrating a tumor. Plasma has massive potential in the medical world, and this is just the tip of the iceberg. The next step will involve clinical trials to optimize the electrochemical technology for treatment in human patients. Thank you for watching. If you've enjoyed our videos, subscribe to our channel for there's more to come.